Hello, my name is Kayla Carmack, and I chose the disease Down syndrome. I chose to study Down syndrome because I have two family members with it. My Uncle Eddie, who enjoys being called Elvis, is 71 years old, and my cousin Lauren is 30. I enjoy being with them because they are fun and outgoing. They enjoy everyone and everything in their lives. I would like to know more about Down syndrome. Not many people know a lot about this disease, even though the ratio of Down syndrome to healthy births is 1 in 691. A healthy cell normally has 23 pairs of chromosomes, or 46 in all. A person inherits one chromosome per pair from the mother's egg and one from the father's sperm. When they combine, the fertilized egg would have 46 chromosomes, but in Down syndrome, chromosome number 21 may divide incorrectly. No one really knows why an egg or sperm cell may divide incorrectly, causing an egg or sperm cell to have an extra chromosome number 21. When the cell with the extra chromosome joins with the normal egg or sperm cell, an embryo develops with 47 chromosomes instead of 46. Down syndrome is called trisomy 21 because individuals with this condition have 3 number 21 chromosomes instead of 2. About 95% of cases of Down syndrome are caused by this type of cell division. Down syndrome is named after the English doctor John Langdon Down. He was the first to categorize the common features of people with this condition. There are 2 rare forms of Down syndrome: translocation Down syndrome and mosaic Down syndrome. In translocation, not all of the chromosomes are triplicated, and in mosaic, not all cells carry the extra chromosome. The top picture is a typical cell division, and the bottom picture is mosaic cell division. This picture is trisomy 21 cell division. Down syndrome is the most frequently occurring chromosomal disorder in the United States, but there is little known definitely about this condition. It is also the least funded major genetic condition. Down syndrome patients may have a shorter lifespan. A life expectancy of only 9 years was common in 1910, but with the help of medicine, the life expectancy is much improved in recent years. My uncle's doctors predicted that he would not live past the age of 11, but with loving care, he has far outlived that prediction. He is now 71 years old. Down's patients may have an upward slant to the eyes, low muscle tone, and a single deep crease across the palm. Often, a baby with Down syndrome may have heart defects, some more than others. Some babies may have intestinal malformations, and vision problems are common. As a Down patient ages, these problems may result in cataracts. Many children with Down syndrome have fluid in the middle ears, as well as other defects of the ear, which causes hearing loss. Lung infections, colds, and ear infections may also be problems for a child with Down syndrome. A few babies with Down syndrome have thyroid deficiency, which may cause growth and brain development problems. About 25% of Down's patients over the age of 35 may begin to show symptoms of Alzheimer's disease. My uncle was diagnosed with Alzheimer's disease a few years ago, but he didn't seem to show any symptoms until he was about 62 years old. 2 kinds of tests may be used to diagnose the disease before a baby is born. There may be screening tests and diagnostic tests. Screening is only an estimate of the chance that the baby may have Down syndrome. Screening may include a blood test and/or an ultrasound. The blood test will measure the amount of particular substances in the blood of the mother. Chromosomal material from the fetus may be circulating in the blood of the mother and may be detected in these blood tests. Age is also a factor to be considered, and these screening tests are available to any pregnant woman. Diagnostic tests are more accurate. They may include CVS and amniocentesis. There is a 1% chance of these tests causing the pregnancy to be terminated, but the results are about 100% accurate in diagnosing Down syndrome. Definitive diagnosis may also be made at birth as the attending physician examines the baby for the symptoms mentioned above. A blood sample may also reveal the information about the baby's cells. One diagnosis has made Early treatment is necessary to ensure Once diagnosis is made, early treatment is necessary to ensure a longer and healthier lifespan, as well as improving lifestyle. All infants with Down syndrome should be looked at by a pediatric cardiologist. Intellectual development may be enhanced by proper treatment beginning very early in childhood. There's no way to predict the mental abilities of a Down patient, but with treatment, each individual may achieve his or her potential. All children with Down syndrome should have access to the same medical treatment and immunizations as children without the syndrome. With early intervention, when a child with Down syndrome develops a cold or other illness, complications may be prevented. Over the years, treatment has improved, but there is no cure for Down syndrome. Prenatal care and prescribed multivitamin with folic acid may improve the possibility of having a healthy baby. Studies are being done to determine the effect of these vitamins, but indications are that 400 micrograms of folic acid per day may help lower the chance of having a baby with birth defects of the brain and spinal cord. At one time, patients with Down syndrome were hidden away and were not allowed to participate in social settings. Gradually, though, the public has become more accepting of people with various types of disabilities. With better medical treatment, Down's patients are living longer and have more opportunities. Most school systems provide training which enables them to develop skills which can be used in the workplace. We have seen examples of Down's patients include attending college, becoming actors, earning gold in Special Olympics, and living independently. With these improvements, however, there is still a need for more education and acceptance.